Welcome to One on One, the Daily Items digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is Dr. Stanley Martin, Director of Infectious Diseases at Geisinger in Danville, interviewed by Joe Sylvester.
Sunbury Motors Ford is coming off with their best-selling year in its 105-year history. SMC is committed to Ford Motor Company to sell 1,000 new Fords in 2020. Wow! Pick from 25 of the totally redesigned 2020 Ford Escapes, and they start as low as $21,960. Take up to $7,500 off MSRP of the all-new 2020 Ford Explorer, and their price from just $33,965. Sunbury Motors is Central PA's truck capital. Choose from over 120 Ford F-150s and Super Duties. Super Duty. The F-Series truck has been the #1 selling vehicle for 43 consecutive years, and SMC has them on sale for as low as $26,794. Sunbury Motors in the North 4th Street Auto Plaza, proudly serving the Susquehanna Valley's transportation needs for over a century.
Welcome to One on One. I'm Joe Sylvester. Today we're talking about coronavirus, and we're here with Dr. Stanley Martin, who's the head of infectious disease at Geisinger. Welcome.
Oh, thank you. Glad to be here.
Maybe you could start off by explaining what exactly the COVID-19 is, which is, I guess, a variation of the coronavirus.
Right. So COVID-19 is the disease name that we're calling the syndrome that people can get from this new coronavirus. This new coronavirus is called the SARS coronavirus 2. You may recall the original SARS coronavirus back in 2003. This virus is very closely related to it, and so that it got this name, number 2 essentially. But the COVID is the abbreviation that we have used most often to describe this infection, coronavirus, infectious disease, 2019.
Okay. People say more people get sick from the flu, and a lot more people get sick from the flu and die from the flu. How does this compare? Is this less dangerous?
Yeah, so influenza, of course, is something we've all become kind of complacent with, right? Because, of course, we have the flu every year it comes through. It can vary from year to year as to how significant the flu is, but it can always be problematic, and certainly, as a general rule, can infect millions of people and result in thousands of people dying every year, certainly just here in the United States, right? Right now, we've had, so far over 500 cases of COVID in the United States, and a handful of deaths, about 20 or so. Influenza has infected millions of people, probably close to 30 million people in the United States, and we've had well over 15,000, probably even close to 20,000 people have died just from influenza this year, including over 100 children throughout the entire country. Nobody blinks an eye when they come to the doctor's office and we say, hey, you should get your flu shot. And a lot of people might say, I don't want to worry about that. But they should.
Well, is this the COVID being blown out of proportion?
Well, that's difficult to answer. We should be concerned about these kinds of outbreaks in the sense that it's novel, right? And we don't have much in the way of pre-existing immunity, and it can be difficult to contain viruses like this. But for the vast majority of people, the illness, the COVID-19 illness, is relatively benign. It is essentially cough, fever, respiratory tract infection that's fairly self-limited. We do know that, of course, it can result in death, rarely. Usually we see that really problematic kind of course in older patients, patients who have a lot of other kinds of underlying medical problems, right? Heart disease, lung problems, cancer, etc. But for average healthy people, it doesn't tend to be quite as bad. And in children in particular, it tends to be even less bad. Kids seem to tolerate COVID much better than us adults do, thankfully.
It's good. It's a good thing.
Yes.
Oh, I read where Geisinger is developing a test or testing for COVID.
Yes.
Where does that stand?
So the test for this virus was, of course, initially being done through the CDC, the U.S. Centers for Disease Control in Atlanta. They've since been trying to disseminate kits, primers for testing, so that different other labs can do the test. And Geisinger is no exception to that and has been developing this test in-house, and we have kits as well. It's a process which doesn't happen overnight. You have to make sure the test is going to work, right? It's got to work every time, right?
What does it entail? Does it take samples, I would imagine?
Right, so for somebody who meets criteria for being tested, right, and we're not testing everybody, but we are testing some people. And what we typically do is we try to get some respiratory secretions. So this can be something as simple as taking a swab and going up into the nose and getting something from the back of the nose into the sinuses, or the back of the throat into what we call the oropharynx. For patients who are really sick in the hospital, who have pneumonia, we try to get secretions from the lungs themselves, right? Whether it's just sputum or where we actually go down with the tube into the lungs and get some samples that way. We can do blood tests as well, and you can even test stool samples, but those are much less commonly done.
Okay. Do you know if GHP or other insurances would cover that testing?
I think right now, if I understand correctly, they are going to be covering that test. I'm not, if you have lots of questions about GHP, you probably should talk to somebody from GHP as opposed to me, but that's my understanding.
And also I've read that a flu shot won't work for this COVID-19,
Yes,
because they're geared towards specific strains.
So the flu vaccine works just for the flu, which is a very specific virus, right? Influenza. And although influenza mutates every year, right, it changes in such a way that the old vaccines don't necessarily provide coverage for what's going around this year, which is why we recommend getting new flu shots every year. It does not, unfortunately, provide coverage for other viruses like coronaviruses or other respiratory viruses, which we have plenty of, unfortunately.
Okay. What has Geisinger done to prepare if there are patients that show up with positive tests?
Yeah, so we've been preparing for this virus since the middle of January, when we started to consider the possibility that it might come to the United States. And a lot of it, of course, has to do with trying to make sure we have protocols in place for who to test and how to test, that we are addressing supply chains and trying to make sure we have all of the necessary medical equipment we might need to take care of patients, right? And to hopefully educate patients about this, so that they can better understand what might be going on as well. So, and that's an ongoing process. I mean, we have, at this point, we're having anywhere from 3 to 5 meetings a week, at this point, talking about this virus. And there's all sorts of various work groups with different focuses.
What kind of precautions would you also take for employees or other patients if you get the COVID patients?
Well, in the clinic, we of course want to try to take patients who might need to be screened for COVID. So first of all, if you are concerned that you could need to be screened for COVID because you have fever, because you have cough, pick up the phone, give us a call, let your doctor's office know what your concerns are and what's happening. That way, we're ready for you when you come to the clinic, right? And we can have the patient put on a mask, right, so that they're not possibly spreading to other people, right? We have masks and hand sanitizer available in the clinics for anybody who might come in, even if they haven't called ahead, so that we can get a jump on that, right? Try to isolate them into, a room by themselves so that we can talk to them, examine them, figure out what's going on. For employees, of course, we want to use masks for the employees to help prevent them from getting infected as well. In the hospital, that's a more complicated round of activities that we do, because in the hospital it's kind of a unique setting, right? We have lots of other sick people, and the isolation procedures we use is a little bit more in depth, but that's essentially what it boils down to, right? It's trying to protect their employees, trying to protect patients, et cetera.
We're going to take a break right now. We'll be right back.
Sunbury Motors Ford is coming off with their best-selling year in its 105-year history. SMC is committed to Ford Motor Company to sell 1,000 new Fords in 2020. Wow! Pick from 25 of the totally redesigned 2020 Ford Escapes, and they start as low as $21,960. Take up to $7,500 off MSRP of the all-new 2020 Ford Explorer, and they're priced from just $33,965. Sunbury Motors is Central PA's truck capital. Choose from over 120 Ford F-150s and Super Duties. Super Duty. The F-Series truck has been the #1 selling vehicle for 43 consecutive years, and SMC has them on sale for as low as $26,794. Sunbury Motors in the North 4th Street Auto Plaza, proudly serving the Susquehanna Valley's transportation needs for over a century.
Welcome back to 101. I'm Joe Sylvester with Dr. Stanley Martin, who's the head of infectious diseases at Geisinger. Dr. Martin, if there were some COVID or coronavirus patients here, would there be enough space and staff to handle an epidemic?
That is, of course, one of the things we've been working on since January, of course, right, is to make sure that we have the equipment available, the staff, the supplies, the rooms, et cetera. And, we very much anticipate being able to take care of all of our patients here.
Are you finding people with routine hospital appointments, they may be canceling because they don't want to come to the hospital where they might pick up some infection?
No, generally not, and people shouldn't be worried about that. As I was talking about earlier, we do have a lot of very significant precautions in place in our hospitals to try to mitigate any problems with the spread of the virus. We feel very comfortable that we could do that, certainly in a hospital setting. As of right now, we have not had a COVID patient in the hospital. We have been testing some people for it when they meet criteria, but so far, so good, right?
If there were, hopefully not, but if there were a widespread epidemic, does Geisinger, in a case like that, work with other hospitals on a network of facilities?
We do, of course, we do that just at baseline too, right? We work with lots of other hospitals. As Geisinger being a large, what we call tertiary referral center, right? So we get a lot of very sick people, a lot of complicated problems that many other hospitals can't necessarily deal with or know how to manage will oftentimes come here. And so we anticipate being able to do that as well for potential COVID patients too.
Okay. Now, I guess we haven't talked about this. What exactly are the symptoms of
Sure.
COVID?
That's a very good question, actually. So, the two biggest symptoms are cough and fever. Cough and fever. Some people will just feel under the weather. What doctors will say, they have myalgias, right? And most people will just say, well, I just feel achy all over and I just, don't feel well. That's myalgias, right? And so a lot of people have that. Headache might be there, may not be. If it becomes more severe, where it's affecting the lungs with what we call lower respiratory tract infection or pneumonia, right? Some people may start to feel short of breath, like they get winded very easily, whether that's with exertion or even just kind of sometimes sitting. And those, of course, that kind of thing is the most worrisome symptom.
Yeah. Can they also get pneumonia?
Yes. And that's what we would be worried about in those particular patients who are maybe struggling a little bit with feeling their breathing, right?
Yeah.
For most patients, though, that wouldn't necessarily happen. For most patients, they may have fever and cough, and of course those patients we would want to be able to try to manage at home or in our clinics, right? But for patients who are having trouble with their breathing, we obviously want to see those patients in our emergency room and in the hospital.
So what can people do? What kind of precautions should people take other than locking themselves up in the
Right. So probably the single biggest thing people can do is to wash their hands. Most viruses, like coronaviruses, are spread with respiratory droplets. So people are coughing and these tiny little bits of saliva kind of float in the air with the virus. They tend to kind of come down on surfaces, and people are touching, you're touching the table, I'm touching the table, now I'm touching my face, you're touching your face, right? And so a lot of these viruses are spread through touch. And so cleaning your hands, alcohol-based hand sanitizers are very effective at preventing the transmission of lots of viruses. If you're going to be around groups of people, whether it's at home, going to the grocery store, going to church, things of that nature, which you usually do every day without thinking, right? Having a hand sanitizer can help a lot. If you are feeling under the weather, starting to have a little cough, practice what we call that cough etiquette, right? Try to cover the cough so that you're not spreading it around to others, right? And if you really are feeling unwell, then stay at home. Don't go to work, don't go to school and spread it to others, right? And if you're feeling too unwell, then please come see us, right? Whether that be in the doctor's office or the hospital, as I said earlier. But those kinds of things can help. Getting your flu shot every year helps, right? Because right now we still have lots of flu circulating around in the community. And one of the first things we'll do if a person comes to the clinic complaining of fever and cough is we're going to test them for the flu. Because odds are they have the flu far more than they have COVID right now. And so getting a flu shot, protecting yourself from that can also help you just in general during this time of year.
Oh, is there a treatment for COVID if someone's hospitalized with it?
Very good question. So unfortunately, because COVID is a coronavirus, it is not susceptible to antibiotics in the same way that a lot of bacterial infections are. And Tamiflu or oseltamivir, which we use to treat influenza, probably doesn't do anything for coronavirus either. There is an investigational antiviral therapy that's being looked at right now through the National Institute of Health. It's essentially an experimental study to see if this antivirus medicine could potentially help COVID patients. We'll see.
How long would it take to come up with a vaccine for this?
Yeah, that's a good question too, right? Because we would like to think that the ultimate solution to something like the coronavirus is a vaccine. And that is difficult to predict. Prior to 2003, scientists weren't really doing much in the way of developing vaccines for coronavirus. But then, of course, we had the original SARS outbreak at that time, and that stimulated a lot of research into the vaccine. But we never got to a point where we could prove that we had a vaccine that would work for SARS. There's been some other coronaviruses that are similar, and there's been some work in that, but we would still anticipate that an effective vaccine for this coronavirus is probably a year away at minimum, and maybe even longer, depending.
And by then, it may be gone.
By then it may have come and gone. It's true, we don't really know.
Well, how long do you see this, or do you anticipate this being around? Or it depends on what precautions people take?
Yeah, that's a good question. And I would hate to even conjecture at this point. The outbreak started in December, right?
Mm-hmm.
December of 2019 in Wuhan, China. And, it's March. And now we have cases in Pennsylvania, right?
Yeah.
So use that trajectory. That's 4 months. What's it going to be like in another 4 months? I don't know, but I would anticipate that we will have a lot more cases in the United States at that point, and it would probably be continuing to spread as well.
So the big question is, should people panic about this or not?
Panicking never helps anything, right? And as I said, the virus is a lot more benign than we initially thought it was, right?
Yeah.
In Wuhan, it seemed much deadlier at first, but we were kind of just looking at the tip of the iceberg there. Being on that front line response was a little bit more challenging. I really had nothing but sympathy for the doctors and healthcare providers in the middle of China who were having to deal with that right at the beginning. We now know a lot more. We now can manage a lot more. We've certainly seen outside of China and other places that people tolerate this much better. So no, panicking shouldn't be done, but some thoughtful precautions, like some of the things that we've talked about today, I think are certainly appropriate.
All right. Well, thank you very much, Dr. Martin.
You're very welcome. Glad to do it.
That's it for One-on-One.